So today, this is Nancy Sorrells, and Nancy is a local historian, and we're Zooming here like the rest of the world. And I missed a meeting, a Rotary Club meeting, where she was talking about the pandemic or the flu or of 1918. So first of all, what was it called?
Well, the influenza of 1918. Some people call it the Spanish flu, but that's erroneous. But it was the flu pandemic of 1918 is how the history books look at it.
Okay. And was it pandemic? Describe what a pandemic is.
Oh, well, pandemic is when a disease goes global. So pan being, like the whole world. So
Pan Am Airlines.
Yeah, like Pan Am or something, But so the pandemic means that it goes all over the world.
Okay. And throughout history, have there been other pandemics?
Oh, there have been a lot of them. There have been the plague, in the what was that, the 1500s, 1600s.
Okay.
So that was probably the worst ever. We have sort of cultural memory of these plagues from the past. For instance, Ring Around the Rosies that we sing, that cute little children's song, is actually about the plague.
How?
Well, so, they knew they had to probably burn the bodies to keep them from spreading, and ashes to ashes, and we all fall down. That's burning the bodies and people dying. And, so it's really a kind of morbid little children's song.
Yeah.
But, so, we forget these, we come through these. And during the Civil War, for instance, it wasn't to be a pandemic because it wasn't global, but for the Civil War, the diseases, it kind of happened like it happened in World War I. And now when you have people coming together who don't necessarily have herd immunity from these things because they're isolated, and they come together, like all these soldiers from all these little rural areas where they'd never been exposed to diseases and had no immunity built up, came together. And so more soldiers died in the Civil War from disease, measles, mumps, and whooping cough, and diphtheria and things like that, than they did actually from bullets and cannons. But not only the people in the Civil War, we had terrible, terrible livestock diseases that came because all these cattle that you needed to feed the army also came from these places that had no immunity because they hadn't been exposed to diseases, and they got together. So we had hog cholera, and the livestock of America was also nearly wiped out because of the Civil War too, or took a big hit. So we're repeating history. There's nothing incredibly new, but each plague has its own unique characteristics.
How long did the 1918 pandemic, the Spanish flu, last?
Well, the worst of it was really in late September and October, but it started, so that we're talking about 1918, and to just kind of put yourself into that time period, America was at war. So we were already on edge, and a lot of terrible things were happening. And because of the war, the world had been at war for several years. We had only been at war for just about a year and a half. And there were shortages. There was news of soldiers being wounded or killed. So we were already in that mode of, this is different than normal, and we need to kind of buck up and get through this. And in the spring of 1918, this influenza hit like it does every year. We're all used to flu happening every year, and the flu season, sometimes the flu season is worse, sometimes it's better. But remember, at the same time in 1918, we were gearing up for the final push of World War I. So we were bringing together all these young men from across the country. A lot of them lived in very rural areas, hadn't really been exposed to any diseases or the outside world, coming together at training camps across the country. And one big training camp was in Fort Riley, Kansas. And Fort Riley, Kansas is also in the Midwest, it's also the flyway for bird migration. So you get thousands of flocks, thousands of birds, you know, in these huge flocks that are going forward or backward for migration. So apparently this influenza that hit in the winter and spring of 1917-18 was in Fort Riley, Kansas, amongst this population of soldiers, and somehow it got mixed in with the avian flu gene that was in these migrating birds. And you realize a lot of our pandemics happen because they are a mutation and they jump from species to species. So in this case, we think right now our virus probably jumped from bats to here. Ebola probably jumped from a primate population maybe into people. So a lot of times, so it mutates, and then we don't have the natural resistance to fight it off, is why it becomes so bad to us. So apparently the flu virus that was hanging around in early 1918 got mixed up with some avian viruses and mutated, and then became a strain of influenza that humans weren't ready to deal with. And this particular virus hit in Fort Riley, Kansas, and really it spread from there around the world in massive proportions.
So really, because of the war and the travel, it caused it, which is kind of like now the travel from China
Right.
or wherever to here, wherever the worldwide travel. And this is
Right. So it hit here. It hit there. You know, you can kind of track it. There was a Navy ship that docked in Boston. They get off. There's a couple cases, and then Boston, all of a sudden, in like just a few days, has it exponentially in the population there. So it was really our military that kind of helped pass it around the world. It becomes called the Spanish flu because once it goes to Europe and starts spreading there becomes newspaper reports out of Spain of this very virulent disease that's killing a lot of people in Spain. And the reason the reports are coming out of the newspapers in Spain is because Spain was neutral at that point in the war. And so they didn't have any kind of censorship that was happening on newspaper reporting like it was happening in America and England and France and Germany and all that, because they were in the middle of war. So there's a little bit of censorship that's always happening about when things can be released. But so the word came out first in Spain, and so it got tagged the Spanish influenza and just never really was able to shake that. But that's really incorrect. We're technically the ones that started it.
It was the
from
Fort Riley.
everything I can read. Yeah.
It was the Kansas.
Right. Right.
So tell me about the Valley. What was going on in the Shenandoah Valley?
Well, so we were at World War II, but the Shenandoah Valley was the agricultural breadbasket of, one of the agricultural breadbaskets of the country too. So we were pushing toward getting harvests done and, supply the home front and the world. August, this influenza, by August, it's starting to kind of show up in the country, here and abroad. The newspapers are starting to read a little bit about it. Late August, there's a little something in the Stanton newspapers. By early September, it's everywhere. At the same time, we're gearing up for the final push in the war. September and October is the Meuse Argonne campaign, which was the biggest, bloodiest campaign of the war, and the one that took us to victory. And a lot of Valley military people were involved in that. And so we're starting to get word back, by telegraph and letters and things, that there's this terrible conflict happening, and that we're feeling a lot of pain in the community because we get word back that people are being wounded and killed in this campaign. So that's happening. You remember that the armistice was signed November 11th. So that was the official end of the war. So we're in the final weeks of the war. So we've got this double whammy happening here, because also September is the time when all the institutions are going back. The schools, Virginia School for the Deaf and the Blind, Mary Baldwin, Stuart Hall. There was Stanton Military Academy, Augusta Military Academy, up in Harrisonburg, the Harrisonburg Normal School, which became James Madison, Bridgewater. So you have all these schools, and Stanton and Waynesboro and Augusta County had a lot of schools, private and public. And they all went back. They didn't go back in August like we go back now. They were going back in September, middle to late September. They're all going back, and they're bringing these diseases, just like today when you go into the schools, it's like schools spread diseases. Well, it was the same thing then. The schools are opening up, and these diseases are starting to come into the communities, and then you just see this explosion of disease and death in second week of September, third week of September in the Valley that's happening. And it got so, by early October, it was so bad that Stanton, Waynesboro, Augusta County, Rockbridge, Lexington, Harrisonburg, Rockingham were in total lockdown. There were public notices and quarantines posted, and people couldn't gather anywhere.
So it's just like, kind of like now.
Kind of like, there are a lot of similarities. I mean, a lot of differences. We wouldn't have had this talk because people were really isolated. And we have more government safety nets than we did then. Maybe we haven't perfected them now, but they're certainly in place, and they wouldn't have been. So everybody was scrambling. The governments by October, they were issuing by about October 7th or 8th here in Augusta County and Stanton and Waynesboro. Both Augusta County and Stanton and Waynesboro were issuing quarantine notices and posting them and running them in the newspaper. And it said that you couldn't have any public gatherings. There were no churches, no moving pictures, which is movies of any sort. And so people were isolated in their homes. And when I say isolated, it's not like you could pick up the phone. Really, maybe you had a phone, but you certainly couldn't have the social media outlet that we had now. So they were truly isolated, and they got sick in their homes. You didn't really have big hospitals that could take care of people. You had some small. King's Daughters was around. That was really our only hospital. It was small, and mostly people were. There's the way you tended yourself at that time was you just took care of yourself at home, and you died at home, or you survived at home. And then while you were sick, the neighbors. I know this one story that's kind of poignant in Stuart's Draft, where the whole family got sick, and what they ended up doing was the neighbors who had already had the disease and survived brought food and left it on their front porch for them. Okay. And so there were some emergency hospitals that were opened up. For instance,
there was no cure for it then.
There's no cure for it. It was just like there's no cure for it now. It was a virus, and we didn't really know how to deal with it. Medically, we kind of dealt with it a lot easier now than then. For instance, what happened was these people got very sick with influenza, just like you do today with influenza. And then there was a secondary infection, very, very often pneumonia, sometimes meningitis. Those kind of things you could treat now with antibiotics, which hadn't been discovered yet. But very often they died of that secondary infection of pneumonia most often. And the odd thing about this influenza, different than any other influenza that we've really ever dealt with in the modern age, or with influenza is a virus, just like our coronavirus. And different than the coronavirus is that this 1918 disease hit the healthiest, strongest individuals the hardest. So in 1 year, the life expectancy in the United States dropped 12 years. And the people that died fastest were those who were the most fit and the youngest. So that would be our military men. And many more of our soldiers died from disease in World War I than died from any battle casualties. especially here. We had about 60 people in Stanton, Waynesboro, Augusta County that died in World War I as a result of World War I, and over half of those were from disease.
Okay. Yeah. What was the public-private partnership like, or how was it different or the same?
Well, so I think the government was even less prepared than we are now to how to deal with it. We didn't have a government that had so many safety nets. We didn't have Social Security or Medicare or anything like that then. And so everybody had to scramble to figure out what to do and how to take care of, So the public school system had to decide what to do. First, the public school system in Augusta County for sure was making the teachers, every day when the students arrived at school, they had to stick out their tongue and be examined by the teacher to see if they had any kind of sneezing and coughing or sore throat. And if they did, they were sent home. And that's probably didn't help with the spread of the disease. But then they finally decided, keep your children home and let's close the schools.
After all the teachers died, right?
After all the teachers died, right. And then, for instance, in Stewart's Draft, since the Stewart's Draft school was closed, and that was a combination of elementary school, high schools, it was where the fire department is now. That school was opened up as a small community hospital. There were 20-some patients that were treated there, and only one of those died. So the sickest of the sick, if they could get them to a hospital or to a large area where they could treat them in mass, they did, but we had no kind of safety net in place to do that. We were inventing it. And I think a lot of what we learned at that time, government-wise, has carried on into other epidemics. I'm not saying pandemics, but we've had epidemics in the past. We've had influenza epidemics. Some of those turned into pandemics too, like the SARS thing a few years ago. We've had polio epidemics. You and I are just young enough that we only remember hearing our parents or our older siblings maybe talking about the polio epidemics. But I remember my parents and my older brothers talking about, in the 50s when everything was locked down in the summertime because there'd be a polio outbreak and you couldn't go swimming, you couldn't go to the movies. So you had these mini lockdowns that we're now doing globally. So they learned a lot from that. And so the government did issue official quarantine notices, posted them up everywhere. And places that were government run, like the draft board. Remember, we're in the middle of a war. So the draft board in Stanton, all the draft board employees were required to wear masks. So
the masks that was something they did even back then.
That was right. And they put ads in the paper that said coughs and sneezes spread diseases. If you're sick, stay at home.
I'm gonna write a song. Yeah. Anyway, Nancy, what do you think we can take away from this?
Well, a couple things. I think one of the things we can take away from it is that we're going to survive it. We're going to be smarter about it. We'll maybe never think about public water fountains and shaking hands and things the same way. Well, I think we're very, very aware now of how we can protect ourselves from these kind of things. I think we'll take away maybe a greater appreciation of our fellow human beings and how much everybody means to each other and how you can do. Yeah, I think it's just amazing some of the things that have come out of this. Like I was able to participate in last week of the food distribution that the Augusta County Public Schools have been doing for their students, taking food out on school buses out to families and also providing a grab and go pickup. They're doing now distributing about 42,000 meals a week out into our community for our students. So those kind of things, which is government related, but as a public-private partnership, because those are the teachers and community members are coming in and volunteering. They're not required to come in and do that, and helping take care of everybody else. So everybody is pitching in and lifting up their fellow man and not just being self, and learning how to think about other people, like wearing the mask. It's not for yourself, it's for the other people out there. And so that maybe we also think about the importance of vaccines. And, everybody says, well, I never get the flu, so I'll never, or when I get the flu, I get sick from it. And that's not, that's a myth, but I don't need to get the flu vaccine because I've never had the flu, so it doesn't bother me. But if you don't get the flu vaccine and then you get and then you become a carrier, even if you're only slightly infected, you're taking it to other people in our community who are more vulnerable. So getting vaccines, you're creating a herd immunity. So you're helping those who are more vulnerable, who, if they get the flu, would die. Whereas you're not going to get, you're just going to get it, maybe be a little sick, inconvenience. But somebody who has an immune deficiency, or someone who's elderly or very young might not survive. And so getting the vaccine is not just for you. It's not a selfish reason. It's a community reason.
How do you think this will affect healthcare? I mean, because there's been a healthcare argument going on in this country since Lincoln, I think. I think it goes
right,
back.
right.
Yeah. And, you can go through the presidents, all the way through the 20th century and see that there were times when they kind of went to quote unquote, I don't want to say it's socialized medicine.
Right.
But this seems to be an advocate for socialized medicine.
Yeah, and I think maybe socialized has become kind of a dirty word. Why don't we just call it our community care?
Public health. Yeah.
Yeah, our thinking about us as a community rather than individuals in silos, and we're all in this together, and how one person is cared for is going to affect another person. And so why not have a blanket community care system where everybody gets equal? A disease is tough enough. Why should it matter about your own social standing, your own finances and resources, about whether you can fight a disease and have good health? So I hope that we come out of it thinking that we're all in this together, and that we need to give equal opportunity to everybody for a stronger and healthier community.
Yeah, whatever that may be.
Whatever that may be, that it's not. It shouldn't be based on your social standing in life. We're all humans, and we're all in this together. And to also realize that you're helping yourself when you're helping other people. So again, if you're all in this together, why segregate, and have one person get more resources and more ability to fight something than the others? Having the other people with who may not be in the same social level as you, they may be above or below you, but having them with as much immunity as possible helps you as well. So you're helping yourself. I mean, it's sort of a community and a social and a selfish reason, I think, to think a little differently about this. I think it's really time to think about universal health care in however that plays out, and don't think about it as a partisan thing or a sort of a political type of thing. It's just a human necessity. If we're going to go forward in a healthier way, I think it's important to make it available and not tie it to your resources, financial resources. One other thing I should point out that's different between now and then is, I mean, we're horrified at the numbers. The numbers of deaths are just staggering, and every death is important, and every death leaves a hole in somebody's heart. We're not approaching, and hope to God we never approach what happened in 1918. There were close to 1 million Americans who died. Worldwide, 13 million people died because of World War I, because of the war and its related effects. 50 million people, 5% of the population of the world, died from the pandemic. And again, those were the healthiest, strongest people. So instantly, there were millions and millions of orphans around the world. You see all the time, there's a story up in Harrisonburg of 6 children were overnight left orphans because the parents, in their 20s or 30s just died, one and then the other within 24 hours. There were two soldiers in the newspapers become filled in late September and early October of when it begins to hit home of young men and young women who are maybe living in Baltimore or Southwest Virginia or something and just starting their lives with two young children. The parents in Stanton and Waynesboro, Augusta County have to go on the train and get the body and bring it back and bury it in Thorn Rose or Riverview or some local cemetery. So the parents are the ones going back and getting their adult children's bodies and bringing them back for burials. Thorn Rose had just in September, October, November, December, 30 some burials that were absolutely flu related burials. Some in one case there was 2 in one day. There's this tragic story of 2 soldiers in the Beard family in Mint Spring. One was stationed in New Jersey and one was stationed down in the Norfolk area. They were both in training, ready to get shipped overseas. They both died of the flu within a week of each other. They brought their bodies back and had a double funeral at Bethel Presbyterian Church. So, I mean, that kind of thing. I mean, there have been young people in the prime of their life now that are dying of this virus, but not the majority. We're saying, the older people with pre-existing conditions are the ones that are the most vulnerable. In 1918, it was those who are healthiest who are most vulnerable. And how do you fight that? How do you fight being fit?
Right. What are you doing personally during this time?
I'm actually, as long as I stay healthy, I'm really liking the gift of time. And I can't remember when my calendar has been so empty of meetings, except for Zoom meetings, of course, and things like this. But
and this is not a Zoom meeting. This is a public service, just to let you know.
This is a public service, and it's actually not. We're not using. Well, yeah, we are. It's not a meeting. Yes, it's not a work related thing. So my husband retired in January. We got a new puppy that same day, and so this has been a gift of time for us to raise a puppy and not have to leave him alone where he can chew up and destroy things, and give him some basic training, and that's been fun. We put in a solar array for our house in January, and it's requiring, because we had to cut down some trees and rework things, it's requiring a lot of re-landscaping. So I'm getting out. When I leave here, I'm going to go out and spread mulch. So I've been doing a lot of that, getting out. And the governor said specifically we're supposed to get out and exercise and enjoy the outdoors. And, in Virginia, the state parks have been left open except for the beaches because you can't go swimming. So as long as we're socially distancing, my friend and I have been going and checking out the natural areas, Natural Bridge State Park, Chessie Trail in Lexington, the Richard Thompson Wildlife Management Area up in Fauquier County, the Blue Ridge Railway Trail over in Nelson County. So we've been checking out Virginia's natural areas, and it's been a brilliant spring. Lots of wildflowers and wildlife to see. So we're trying to make the best of it.
You got that camera working, don't you? Yeah.
Get the camera working, right? And also helping and trying to do what we can. I've been checking in on some elderly neighbors and doing some grocery shopping for them, and trying to be real careful with wearing our masks and gloves out, and being socially smart with our distancing and doing things like that. So, and we also have the Augusta County Historical Society. We developed a couple years ago a historical driving tour. It's supposed to be our pilot program, and it's a 34-mile driving tour from Stanton down to Middlebrook, over to Greenville, and back up along the Avenue of Trees around Mint Spring, back into Stanton. We printed up a map, and we've taken that whole thing and turned it into a PDF downloadable off of our website, which is AugustaCountyHS.org. And you can print that out and take the driving tour, and people have been really enjoying doing that. And so hopefully when we get back going again, we'll do another couple of tours around the county and keep rolling with that. So that's been a lifesaver for people who are getting a little stir crazy, want to get out without violating any of the social distancing rules.
Okay. Well, thank you for doing this today. And this, once again, this is Nancy Sorrells, who's a local historian and advocate of many things. So thank you, Nancy.
Hey, Richard, can I just add a couple more little quick things?
Absolutely.
About how people were just like we are a little bit, we don't know what to do. We're trying to grab on miracle drugs and other cures, and we're doing what we can, but the frustration and the anxiety was perhaps even higher in 1918. The newspapers are filled with ads. This was sort of the height of the quack medicine era and cures for everything. So all the stores were selling all these medicines that would cure everything, the flu and all its after effects. Some of the medicines included lovely things like strychnine, that was being sold as a cure in downtown Stanton. Also, after you've had the flu, they wanted you to fumigate the area, so they sold formaldehyde candles that you could burn. And so there are a lot of things like that. And John Heatwell, who was like the legendary folklorist for the Valley, who passed away from cancer a few years ago. Before he died, he gave me a lot of his artifacts, his notes, his books, and things that he gathered. And one of the things that he gathered was this, and you missed the Rotary meeting, but I passed it around to everybody. This is asafoetida bag, and you can't smell it, but it's really horrible.
Raise that up a little bit, right? Oh man.
And you see these a lot. It's herbs and stinky stuff, turpentine and things like that that's put in there, and the parents would put this around their kids' neck and send them to school with this, not just during the influenza, but it kind of had its heyday during the influenza. But and the kids who wore these things, they would do it every winter, during flu season. And kids that wore these things said they were always so embarrassed at school because all the other kids would tease them and they smelled so badly. And it does. So I'm going to put it back in its jar. John gave it to me, and we'll seal it up until the next pandemic.
The John Heatwell Memorial.
Yes, but I have to thank him for that, because I've read about him, but I never knew it until he gave me that, and I tucked it away, and then I realized a couple months ago that I had it, and it's like, okay, there's a reason why I had this.
Yeah. All right. Well, thank you, Nancy, and thank you for being here and doing this and doing all you do for the community.
Well, thank you. Thanks, Richard.